You'll hear me?
Yes.
Okay, just it's synchronizing. Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. I'm just checking my phone now to see if I'm live, waiting for it to pop up on my phone so I know you can all see me. And Dr. Cazeau, if you do see me, it says we are playing. Oh, I see 6 people are on. I don't see it yet on my phone so that I can see your questions. I'm still waiting to see the live feed. Give me a second. Let me go back out, come back into the VBF technology. Oh, here we are. All right, there we go. Hi, Katie. Anyways, welcome everybody to the February 2022 VBF Facebook Live. Today's topic, infantile hemangiomas, the treatment and management. We are, today we have Dr. Christine Cazeau from Pierre Fabre. She is the VP of Medical Affairs for Pierre Fabre USA. And Pierre Fabre is the company that brings us hemangiol, the only FDA approved drug for the treatment of infantile hemangiomas. So hi, Ava. I can see Ava's on and Kelsey. And we are ready. Hello, Dr. Cazeau, how are you?
Hi, Dr. Linda. I'm fine, and you? Thank you for having me tonight.
Thank you for being here. I know you're in Arizona and I'm here in New York, and it's very windy, so I don't know if this is affecting the internet, but we'll do our best to get through tonight. Also, I'm a little challenged when it comes to technology, so I'm winging.
I think you're doing well. You're doing very good.
We got it. So everybody that's on, we have 11, 12 people, they're jumping on. We need to hear your questions about the diagnosis, treatment of infantile hemangiomas, drug therapies, when you can start, any problems or complications. A lot of you moms have been writing into me with your babies having, maybe they throw up and you don't know whether you should continue the dosing, or they're having diarrhea or reflux problems. So Dr. Cazeau is here to answer your questions. Anytime you want to start. Also, things are getting back to normal. So I think we're all excited, right, Dr. Cazeau, that we can start traveling again to our medical meetings and getting back to the business at hand, which is making sure every individual with a vascular birthmark anomaly or related syndrome gets an accurate diagnosis and an appropriate treatment. So we are ready to take your questions. While I'm waiting for the questions to synchronize, we know hemangiomas available in the US, but what other countries is it available in?
Oh, you know, Linda, the drug for, as you said, hemangiol, has been approved by the FDA a few years ago. I think it was in 2014. But at the same time, the same year, it was also approved by the European Medicine Agency. So that means all the 27 countries in Europe have the approval at the same time to have hemangiol for the babies who have infantile hemangioma. So yes, so we can say all the countries that are in the European Union first, and then we're gonna have, so Mexico is the next country where we have hemangiol is getting available right now. So it's just approved because Mexico take longer than other countries to have drug approval. So yes, our colleagues in Mexico are launching hemangiol in Mexico that will be in April 2022. So that's a very great news. Otherwise, we have hemangiol in Middle East countries, but we also have it in other countries in Asia. So that's Japan is the first country that it has been developed. Knowing that in Japan we needed to have a specific study with Japanese babies to make sure that the way that they metabolize the drug is okay according to the standard that sometimes it's some drug we don't depending of the population, we don't metabolize it in the same way. So we conducted the study and it was very successful, and that's why in Japan the hemangiol is very, very well renowned, as the drug is really used a lot by the population there. So we are very happy. So we can say that there's a lot of countries that Europe, Asia, or Australia. I didn't speak about Australia. Australia is also a country where we have hemangiol. So I said Mexico, and also other countries in South America. So we plan to have it there. So yeah, we're still working on it, and yeah, to make it available for all babies with infantile hemangioma that will need systemic treatment, so oral treatment for this condition. So we are very happy that we are able to bring that for these babies.
That is excellent news. And I know one country that you're aware of that we get almost daily requests from is the Philippines.
Yes.
And I don't know if they'll be on the horizon, but almost every day they're like, when are we going to get hemangiol?
So I don't know exactly how it will work, because what happened there is Pierre Fabre has partners in Philippines. We don't have a specific, the company is not based there, but in Asia we have other partners that can develop that. But it's also the fact that we are not directly there, we have to use the partners that we have there. That makes the process a little bit more complicated, because we have to go with what priorities that the local partners have. So that's the issues that we are facing, but we hope that we will be able to find a solution for that.
That's awesome. And Claire is on, and Lisa, Sajid, Julie, Ken, all of you. We have a question from Canada for you. My daughter, this is from Kelsey Davis. She says, hi from Canada. My daughter has been on hemangiol since 3 months old. Currently, she is 8 months old. She has 2 hemangiomas. In the 5 months, the one on her scalp has completely disappeared, which is great to hear. But the one on her cheek hasn't changed much, but it hasn't grown either. Is there a reason why some respond better than others in different areas?
What the challenge with infantile hemangioma is the heterogeneity of the disease. What I mean by that is you have a lot of hemangioma, infantile hemangioma, that will not have the same evolution. We know overall how the disease is working, where the fact that we have hemangioma that will appear, in the first weeks or first months, and then that they will grow, and then after 5-6 months of age, that you have the involution. But in the meantime, you may have some detrimental effect on the body. So that's why we are trying to treat the ones that really require this type of treatment. But also we need to say, but some location for an infantile hemangioma between 2 babies may not have the same evolution. And that's why, every case is unique and every hemangioma is unique. So in my experience, because I work with a lot of babies with infantile hemangioma, and with different ages also, in my experience, it may happen that for the same, you have an hemangioma that will go very well on the drug, but you have another one that will respond less. It may not be the same thing for every physician, but in my personal experience, sometimes it may be the dose. And the dose may be, that will reach one hemangioma and work very well. Let's say, if you use 1 to 3 milligram per kilogram per day, which is the marketing authorization, the dose that is authorized by the FDA and also by the other countries. But sometimes some physicians, and me personally too, sometimes we have to go above that dose, but under control, of course, but it may be necessary. I'm not saying that it's what is happening for your hemangioma, because I don't see it and I don't know. But I'm saying about my experience, what it was. And sometimes you may need to adjust the dose, particularly if it's under 3 milligrams per kilogram per day.
Okay, thank you. We have some questions rolling in. Nan McCarty says, I have a 3-week-old who had a hemangioma show up a couple of weeks ago. It's growing rapidly and located over her trachea. So they began treating her with timolol. The growth has stopped and we had an ultrasound done today, still waiting results. We have a referral into a pediatric derm. Do you recommend an oral treatment as well if it stays at its current size?
At three weeks old, it's normally we prefer to wait to see if it's growing, if it continues to grow, because 3 weeks it's a little bit young, because we recommend the treatment 5 weeks old for the baby to be. And the exception could be off-label use from other age, but normally it's 5 weeks old. At 3 weeks old, I would consider the treatment unless there's very important functional issues associated with the lesion. So if it stopped growing and then you have an imagery that is ongoing, let's see what that will show, and then we will advise. So I believe your physician will advise accordingly. So for now, I would wait.
Right. So what you're basically saying is standard is wait till 5 weeks to start, because that's usually when the bulk is going to appear. But if there's like an airway problem or a vision problem,
yes,
then of course you will. So
yes,
that makes a lot of sense.
Mm-hmm.
Rachel has a question. She says, my daughter is over a year old and the doctors are just blowing this off. Is it too late to start treatment? And it still appears to be growing.
Usually, we consider that the infantile hemangioma stage of proliferation usually stop around 1 year old. But in some cases, yes, it may continue to grow around that age. So that's why I was saying a little bit earlier, it's treating infantile hemangioma, it's 1-by-1 case. Yes, commonly that's a time that we are not in the proliferation phase anymore. But if it may be the case that the infantile hemangioma is still growing. I used to work in France, and in France, before we have hemangiol available, we had what we call the compassionate use program, where we were waiting to have the approval from the health authorities to have the drug for all the babies with infantile hemangioma. So in the meantime, we had the authorization of the health authorities in Europe to use the drug for babies who still have proliferation phase of their infantile hemangioma. And I remember at that time, yes, we had a lot of children who, we would expect that they were, more than 1 year old, and they were still in the proliferation phase at that time. So that's the only condition. So because it's really well stated that you need to treat during the proliferation phase to stop the growth of the infantile hemangioma. So which is, between the first month, like we said, 5 weeks to 5 months. So between the first 6 months, per se, that's when definitely is the proliferation phase. So after that, we tend to consider that it's not proliferating anymore, but this is also an evaluation of the physician to say, oh, okay, should we, are we still in proliferation? Or if we are not, we need to consider another treatment.
Okay, thank you. Well, Rachel added a little more information that I didn't initially see. And I think, Rachel, you should email me at vbfpresident@gmail.com with some pictures, because she says it's on her tongue. And that usually is a malformation.
Oh,
And as you and I both know, there's about a 65%, if not more, misdiagnosis rate between
yes, of
hemangiomas
course.
and malformations. So don't worry, Rachel, it's never too late to treat. But let's get an accurate diagnosis and have one of our experts look at this, because it really sounds like it might either be a lymphatic or a venous. The
A
lymphatic
venous malformation, yeah.
Yeah. So please write to me. My email is in the string, but it's vbfpresident@gmail.com, and we'll have our, oh yeah, she said it was present at birth. So
So it may be a malformation.
yeah, and so Rachel, email me, vbfpresident@gmail.com, tell me where you live, and we will get you to an expert that will look at this and make sure what it is. Because if indeed it is a malformation, then hemangiol is not the appropriate treatment, correct, Dr. Cazeau?
Yes, yes, of course.
Okay, so Nan just wanted a clarification. 5 weeks since birth, my girl was born 2 weeks early. So when they're premature, yeah, when they're premature, how do you adjust?
Yes, so when the babies are premature, we need to have what they call corrected age. So the baby needs to have, so if the baby was born 2 weeks before term, so the corrected age will be when she will reach the number of weeks that was missing. Like 2 weeks before she was born, 2 weeks before. So at 2 weeks of birth, that's when she reached her corrected age. So, and then from there we count the 5 weeks.
Okay. Makes sense. Julie Rhodes has a question, but again, it's not really related to infantile hemangioma, but with all the confusion, she has a 7-year-old that has 4 intramuscular VMs. He's not on any medications, previously was on aspirin. Please email me, Julie, and we can get you directly in contact with one of our intramuscular VM experts, like Dr. Coletti or Dr. Weiner or Dr. Rosen, because again, these intramuscular venous malformations are not appropriate for being treated with the hemangiol. Correct, Dr. Cazeau?
Correct. Hemangiol is only for infantile hemangioma, which is a tumor, not a malformation.
Right. So again, Julie, email me. Oh, excuse me. Yeah, again, Julie, email me at vbfpresident@gmail.com with a picture and any medical records so I can forward them to one of our medical experts, because it's, yeah, it sounds like there's some complications. Okay, another question, Kelly Baird Minter. My pediatrician blew off our area on our forearm and where the hemangioma is, currently waiting to see a pediatric dermatologist. 4 weeks old, but it was present at birth. Our infantile hemangiomas sometimes, never, or always present at birth?
No, 50%, 50 to 60% of infantile hemangioma are not present at birth. Sometimes it may be present at birth, but it's not the majority of the case. So, and most of the time, if you have a lesion that is present at birth, I prefer to have a specialist to look at it, because it may be something else than infantile hemangioma.
Exactly. So Kelly Beard, again, if you can email me some photos so we can, and that's how you get, she asked, how can I get the proper diagnosis? We refer your case to one of our medical experts, and then they can give you instructions on where to go to get an imaging study to confirm. Most of these that are complicated require an ultrasound or an imaging study to confirm what is, because they can be very confusing.
Yes,
and they overlap, and they can overlap. So Martha says, forgive me if you already addressed my question, but what is the difference between timolol and hemangiol?
Oh, okay. Hemangiol is propanol, and timolol is it's another beta. Both of them are what we call beta blockers. So they are drugs that have an action on blood vessels. And so timolol is a topical drug that is used usually for glaucoma. And it's a very potent, I don't know how to say that, it's a very powerful drug, and that's why in a few years ago, when they discovered all the classes of beta blockers, we used to use timolol orally, but because it's so potent and had a lot of side effects, so the medical community decided that they will not using timolol anymore this way. So that's why only use that timolol have currently is for glaucoma, which is the tension on the eye. So that's why we have it in gel forming solution or liquid solution for the eye. So timolol is that. Propanol is a beta blocker that is used in arrhythmia. So the people who have problem in heart in the cardiac rhythm or hypertension. So it happened, this is the story of hemangio. It happened that we had a baby who had an infantile hemangioma and who had a cardiac issue. And then this baby was placed on propanol for the cardiac issue. And we realized that the hemangioma was shrinking while she was taking the drug. And that's how the efficacy of hemangio, of propanol in infantile hemangioma was discovered. And that's why now we have a drug that is propanol based, where we use it specifically for infantile hemangioma, which is hemangiol. So that's the difference. I don't know if I made it clear. If I didn't, yeah, please help me. I can do it. I can do it again. So knowing that, as I said, propanol is a specific drug that has been studied, particularly with all the studies that we conducted with hemangiol to treat infantile hemangioma. Timolol is a drug that is used for glaucoma, but because it's a topical solution, sometimes doctors use it what we call off-label. That means, so you are using a drug that is not the intention, and then you're using it because you're applying the gel forming solution for the eye on the skin. So that's why we heard about timolol.
Okay, thank you. So Ava says her baby has face syndrome, and they believe that she has posterior fossa involvement, and that her doctors suggested that she may not be a candidate for beta blocker. Is that true, and why would that be true?
In the beginning, when we started on with hemangiol, we had a lot of fear, because what happened is, because it's a beta blocker, and as I said in the beginning, we have an action on the blood vessel. We have a decrease of the pressure of the blood vessel that is happening. So for babies with face syndrome, there was a lot of concern about the fact that the anomalies that are in the associated in the brain with the in the face syndrome patients, that if the fact that we are decreasing the pressure of the blood, that may have an effect of it. But several studies has been conducted with these babies, and they didn't show any anomalies that would be affected by the fact they were taking the treatment. However, one of the precautions that that is commonly admitted by the medical community is, babies with face syndrome, we start them with lower dose and we increase it very progressively, and then we monitor them closer than the normal babies.
Oh, that's excellent. Good information for me to know as well. By the way, in this string, we've posted the link to hemangio.com. So you can go there and see a lot of answers to feeding, dosing, when to give it, if the baby throws up, if you should do it or not. It's a wealth of information, and you should go there. It's a great, great resource. So Nan has a question. She said, my friend's daughter will be 2 in June. She has 2 hemangiomas and they tried timolol on her after age 1 with no result. Would hemangiol be useful at the age of 2 in speeding up involution?
It may, but it's, as I said earlier, only if we're still in the proliferation phase. Normally, I have to say that doctors who are using that are doing it what we call off-label, because we consider that the proliferation phase is, between 5 weeks and 5 months. But we know that there's some cases where the hemangioma is still on proliferation phase, after that age. So, but that's the doctor decision, and to evaluate the hemangioma and see if it's a proliferating phase still, and then to treat accordingly.
Thank you. And Scott wants to know, is there any advantage during the early proliferative phase of an infantile hemangioma to combine the laser with hemangiol?
Not that I am aware of, because what we saw is we may decrease the need for laser when you use infantile, when you use hemangiol early for some babies. Some babies where we have an infantile hemangioma that at some point you may need some, may have some to treat them with laser. We may not need the laser, or need less laser treatment, because when the child will arrive, if the treatment is well conducted, and then you have you stop the progression of the infantile hemangioma, you will arrive at a phase when the child will be ready to go to school, is when usually you consider laser, because you still have some some blood vessels that are under the skin that can be visible, and the laser could be the right treatment to do at that time. And there's another aspect of it also to consider, because remember, to do laser, we need general anesthesia. So, and general anesthesia before 2-3 years old is less and less advised by the medical community. And we know now, unless it's definitely mandatory or paramount for a baby to have anesthesia before 3 years old, that's when we tend not to do it. And that's why we are trying to, the fact that we are having hemangiol to be able to treat the babies at that age and avoid all the complications that not treating the infantile hemangioma may bring. So that's why it's important to treat them and consider laser, at some age if needed. Because anesthesia, we know now, there's several studies that has shown that anesthesia before those age, we should avoid them for babies' neurodevelopment.
Thank you for that. If my so Cindy wants to know, if my baby doesn't respond to the hemangiol, should we consider surgery?
Doesn't respond, there's a lot of interpretation to that. If the treatment has been started by an expert physician, where the diagnosis has been well stated, well done, and then the treatment is given, and there's no, because usually we had several cases also where people are saying that the drug is not working, and it's either because it wasn't an infantile hemangioma, or the drug was not been given. I'm not saying that's the case here, but it may not be not an infantile hemangioma. It may be something else than infantile hemangioma, because usually, even with the first dose, you saw something happen when it's an infantile hemangioma. So, so the diagnostic, that's what I would question first, and then if it's an infantile hemangioma, if it's considered that the diagnostic is well established as an infantile hemangioma, so questioning the dosing, because we know that certain infantile hemangioma may respond better to the highest dose than to the lowest dose. So that's also something to consider. And at some point, the age that the treatment started, it's also something to consider, because if the hemangioma was not in the proliferation phase, that's also something that may not give the great results that we usually see. But in our experience, and Linda, you can also testify on that. Usually, if it's an infantile hemangioma, and then the treatment is at the right, well given at the right dose, usually you have an effect. And I was speaking earlier about the studies that we conducted. We measure it very strictly, like you have a complete disappearance in 64 to 65% of the patients, and then you have a partially disappearance practically in everyone in the studies.
Okay, thank you. This is a very interesting question from Jeffrey from California. He says, there's a lot of talk in the hemangioma discussion groups. My daughter has been on the generic for 4 months now, and she shakes a lot and has trouble sleeping. My wife thinks it's related to this drug, and some of the mothers are saying that when they switch to hemangiol, that the shaking and the sleep problems ceased. Is this true, and could this be related? Is there a correlation to the generic versus the hemangiol?
And hemangio, we don't have specific studies to show the difference in terms of sleep disturbances for the two drugs. What we know is, propanol may induce sleep disturbances that has been reported. But on the same time, usually we are talking about babies that are very young too. So the reporting of sleep disturbances vary a lot depending of the studies and the publication. So in terms of generic, yes, we have a lot of data, a lot of reports showing that we have less side effects associated with the generic than the hemangiol itself. So particularly the regurgitation or the baby rejecting the medication, and also the reflux that the babies usually have when they have the generic, and they don't have that when they are having hemangiol. And also the fact that hemangiol seems to be better accepted by the babies than the adult solution that is given. So I cannot say that it's directly linked to that, but I know that a lot of parents, and I saw some testimony from the different website and also from the VBF, where parents are giving testimony where their children were on the adult formulation, and then after that and they had side effects, and after that when they switched to hemangiol, it changed completely. So I believe that it may have some good effect to that.
Thank you. Very interesting question from Martha Bagetto. I hope I didn't beat up that name. But anyway, she wants to know, is it safe to say that infantile hemangioma should get a consult to a pediatric dermatologist and not be solely managed by a pediatrician?
So because pediatric dermatologists are seeing all the specialists for infantile hemangioma, I would say it's always good to make sure that the baby is seeing a specialist, which could be a pediatric dermatologist. Pediatric dermatologists are the ones that are the biggest group of experts on infantile hemangioma. You also have pediatric hemato-oncologists that may also be an expert depending on where you are, but sometimes pediatric ENT, pediatric ophthalmologists also, and sometimes even some surgeon, a pediatric surgeon may also have a lot of also a part of the expert group that are treating infantile hemangioma. So it's always good because if the pediatricians or seeing a lot of infantile hemangioma are well trained to manage them, yes. But in our experience, it happened that it's not often the case. And that's why we usually suggest to see an expert in the area where you are.
And
Which
as
would
we,
be a pediatric dermatologist. What were you saying?
oh, I'm sorry. What I wanted to say is we always tell the parents, if you know, follow that voice inside of you that says, you know, if the doctor's saying leave it alone and you feel something should be done, follow that voice and go to a pediatric dermatologist, because they're more current with the treatment of infantile hemangiomas. You know, general pediatricians, they have so many
Other
things to
diseases
be
that they are seeing
concerned
that
with.
are most common.
Yeah, so I mean, we always say start with your pediatrician, but if you don't get anywhere, go see a pediatric dermatologist. Sajid's been writing, and he is an adult, and he talked about a hemangioma on his lip and had surgery. And I just want to say once again, because these are so misdiagnosed, it's probably a malformation. If you need an opinion, you can email me the photos, or you know, we have asked the expert on our website, but it's likely a malformation. But you know, it's still taking, I've been doing this for 28 years and there's still a lot of confusion between what's a hemangioma and what's a malformation. But usually when an adult or anyone over 10 years old is in contact with us for information, we typically know if it's growing, it's not an infantile hemangioma. So Kelsey wants to know, is there any benefit to combining timolol with hemangiol?
Not that I am aware of. I know some physicians are doing that, but normally if the diagnostic is there and the treatment is well conducted, you don't need that. Moreover, there's something I didn't say when I spoke about timolol earlier, is the fact that it's a very powerful drug. The side effects are also very powerful. So we know that when we are giving propanol, that we are giving a certain dose, and then at this certain dose, we are expecting you know, some side effect that may happen, that may not happen. But when we are giving timolol, particularly because it's a drug that is supposed to be, you know, with drops in the eye, and then you are putting it on the skin, you never know with what quantity exactly that you are given, and what quantity is actually absorbed by the skin. Knowing that the infantile hemangioma is a vascular tumor, that means it's a tumor that is built on blood vessels. So you have blood vessels that are wide open on the skin, and then you are dropping beta blockers on this. And the side effect associated with it is the decrease of the heart rate. So the heartbeat of the baby will, you know, slow down, and you will also have the risk of the decrease of the blood pressure. So because of that, and that's why the majority of the you know, all the experts will agreed that they may use the timolol off label as a treatment, but only in the hemangioma that are very, very small, but they will not use it in combination with propanol. That's the first thing. And when you are using propanol, it's because you realize that you need a systemic drug. You need a drug that you will take orally by the mouth, and that's why you are giving the baby that drug. So that means you don't need the topical one.
Thank you. And I just want to give a shout out, if any of you are able. On March 11th, I will be in Milan, Italy with Dr. Coletti. We will be doing a free laser, ultrasound, and dental clinic. You can get that information at birthmark.org/Milan. And these ultrasound assessments are really critical for separating the hemangiomas from the malformations. And they've been working really well for us. And we're beginning to integrate the ultrasound into every one of our free super clinics. So we have the big one in October, and then we have this one in Milan, Italy. So you can get that information on our website.
That's great. Congratulations.
Thank you.
Yeah, looking forward to hear more about it.
Yep. Next question is from Kristen Birch. She says, my son will be 3 on Saturday. He was on propanol for close to a year, was weaned off, and eventually had a hemangioma removed from his eye. He still has other hemangiomas, but they aren't as concerning. Will the remaining hemangiomas go away on their own over time? And is it just a cosmetic issue, or should we pursue further treatment?
3 years old, you said?
Yes, he's
Okay.
currently 3.
So usually the treatment, when we are doing it at the proliferating phase, it's to stop the progression of the disease. So if your son has severe infantile hemangioma, that means we were able to stop the progression of the disease with the treatment. So at some point, yes, because the natural course of the disease is to have what we call an involution. So it's gonna become a little bit flat, fatty, with the exceeding skin where he had the infantile hemangioma. So at that time, at some time, so later on, it may be something that will go away and we don't have anything to do, but sometimes we may need to consider either laser, as I was saying before, just for the trace of the blood vessels that you may have under the skin, or you may have you may need to consider surgery because we have the excess of skin that will remain a little bit fatty on the location where he had the infantile hemangioma. So that's what will happen, but that could be considered later, and you may not need to go there.
All right, thank you. And just to let everyone know, we have 15 minutes left. This is a 1-hour session. We have links to you to speak to Dr. Cazeau. You can email me, and we have posted the link for hemangiol. So Sherry has a question. She says, in children treated with hemangiol who develop side effects or viral pneumonia, do you consider other selective beta blockers?
Viral pneumonia is not a consequence of the treatment. So in babies, normally you have bronchitis, you have all the respiratory tract infection that happen, but it may happen that the baby has the infection during the treatment. What is possible is the fact that the propanol, so I'm gonna be a little bit technique here, it has an effect on the blood vessel, but it also has an effect on the cells of the lungs. So that's why sometimes we recommend, if the baby already had 3 sessions of bronchitis, not to use the treatment right away, or to use it under close monitoring. So in the case where the baby had an infection or have pulmonary diseases, let's say that way, yes, I know that the beta blockers that are selective, because propanol is non-selective, so that means it has the activity on the blood vessels but also on the lung. So we have other beta blockers that are non-selective, that are selective, that will go only on the blood vessels. I know that some people are considering them, but we know that also that it's completely off-label, and they were not studied as much as propanol has been studied for this condition. But it's definitely a decision that your doctor could take.
Thank you. Paige wants to know, my daughter was diagnosed with an infantile hemangioma, but later it was reclassified as a congenital hemangioma, partially involuting. They called it a PICH, P-I-C-H. My doctor insisted that the lesion should be treated with a beta blocker. Was this the proper course of treatment?
Normally, hemangiol is not indicated for the congenital infantile hemangioma for a simple reason. The congenital hemangiomas has some a specificity, and the other hemangioma has also a specificity that is directly linked to the effect of the beta blocker, of the effect of the treatment. We have a specific marker. We call it GLUT1, GLUT-1. The GLUT1 is a marker that is visible in the hemangiomas, the current hemangiomas. So, and then, but in the congenital hemangiomas, we don't have the GLUT1. So when you use the marker, you don't find this marker in those lesions. So the GLUT1 studies have shown that it's only when you have the GLUT1 positive, which is the case in infantile hemangioma, regular infantile hemangiomas, you have an effect of the beta blocker. So in congenital hemangioma, because you don't have the GLUT1, the treatment will not work. So hemangiol doesn't have an indication for congenital hemangiomas.
So when in doubt, get blood work done to determine if it's GLUT1 positive or negative, and then that'll be definitive, correct?
Yes, yes.
That's great information. So Anna writes, my son has a recurring pyogenic granuloma, and it has responded to hemangiol. Is this a normal indication?
We do that all the time as doctors. Because we know what a drug could do, when we are seeking for solutions, we use it in conditions where we think that it's an effect. So a pyogenic granuloma is it's also a blood tumor. It's an excess of it's a process of the healing. It's a healing process where you have an excessive vascularization that happened, and then it happened that you have this tumor that came out, and then yes, and because it's tumor and then it's blood vessels. Yes, there's a lot of studies that has shown that it's working. Propanol is working on this type of condition, but hemangioal doesn't have the indication. So it's an off-label use, and if it works, yes, but it's not the indication. Hemangioal has been developed for infantile hemangiomas, and that's the indication that we have. But after that, physician, because they know what the disease is and they know what the drug is, they may have the off-label use, but that's their decision.
So Scott wants to know, this is an interesting question. Will hemangiol come out in a topical, and will it be able to be used on port wine stains?
So unfortunately, because of the reason that I was speaking about earlier, you remember the GLUT1? We
Yes.
don't have that in port wine stain. So we cannot use hemangiol for this condition, either orally or topically. So no, unfortunately, Scott, no, we will not use hemangiol for port wine stain.
But will it be coming out in a topical? That was the other part.
So a topical, I have to say that it was one of the projects that we had, but at the same time, what happened is the indication will be the small infantile hemangioma that either we wouldn't treat at all normally, or that the parents would not want to treat. What happened is propanol is very, very, very difficult to formulate in a topical product. We tried, and the only way that we could have the molecule of propanol in a topical formula, in a topical vehicle, was a gel. A gel means you need to have alcohol. So alcohol, sometimes if the baby, has an irritation or has some kind of irritation on the skin, so it's gonna burn. So we didn't want to have a product that will will burn for this, because it will target only the small infantile hemangiomas, and we realize that it doesn't worth it to have something that will cause pain to babies, where we know that we may not have to treat those lesions because they are so small.
Thank you. Sometimes I think there's doctors on here asking questions because they always sound like medical experts.
So that means they are doing their research, and that's great.
Yeah, I like it. So Cher says, when an infantile hemangioma being treated with hemangiol develops an ulceration, do you change therapy?
No, because we know in some case, the ulceration could be a consequence that the treatment is working. Unfortunately, it happened that the fact that you have the blood vessels that are decreasing, you have the pressure that is decreasing in that, so you may have ulceration associated with it. So what we usually do is, depending of the dose of when that happened, if the dose, we were already in a high dose, we decrease it. If not, we keep it lower dose, and we try to keep the wound care associated with it.
That's excellent. This is an interesting question from Paige. How long is the longest that a child should be on hemangiol or any beta blocker? My son is 3, and he was on it for over 2 years.
So that's where the limitation of a new drug come out. So when we tested we make the studies with infantile with hemangiol and infantile hemangioma in the beginning, we know that for some children 6 months may be enough, and then we may need another 6 months, so total 1 year overall for the treatment. So, and now there's several studies that has been conducted by different academic centers in different countries showing that the minimum that the baby could be on infantile is when the child reached the age of 1, that's when we consider. But also because infantile hemangioma are very, you have a lot of heterogeneity, because each infantile hemangioma is a specific case. Sometimes you may, some physicians, from the feedback that I'm having from doctors who are treating infantile hemangioma, they said, oh, every time I try to decrease the dose or to stop the treatment, the infantile hemangioma come back. And it happened particularly when you have the proliferation is still going on, and that's why probably physicians could decide to keep it longer. But it will happen at some point that they will pass this phase, and they will be able to stop the treatment.
Thank you. Well, we got 4 minutes left, and wow, what a great question this is. Mike says, my daughter was on the generic. She was having a lot of problems with diarrhea. So we went to ask our pediatrician to switch us to hemangiol, but our insurance wouldn't approve it. What should we do? So
I'm not the best person to talk about that, but I can give some insight. So normally, if your doctor prescribed hemangiol for your baby, if even normally the Pierre Fabre, because we are a foundation, we don't want to leave any baby out. So if your doctor prescribe it and your insurance deny it, we have a system where we need to, the specialty pharmacy who is in charge, they will contact you and make sure that you can get the drug, even if it's at our cost, Pierre Fabre. But there's a few steps that I'm not completely aware of. There's a few steps you need to follow. But what I know is we, Pierre Fabre, we decided that we will not let any baby out of this treatment, even when your insurance deny it. So if your baby has been prescribed infantile hemangioma and then your insurance deny it, so probably you need to have your pediatrician to speak with our specialty pharmacy or the pharmacy that he ordered it to, because we know there's a process for that.
Thank you. And by the way, this is a good time to mention that VBF is working with a major lobby group to mandate that insurance companies cover the treatment of all vascular birthmarks. There's a high denial rate for surgeries, for proper drug management, for laser, for genetic testing. And we're very excited that it's been on delay because of Biden's major infrastructure going on right now. But in 2 weeks, we pick back up and we start our lobbying effort. And, you know, Lord willing, prayers, we're back on track to get this bill, the Child's Treatment of Vascular Anomalies Act, passed. And you'll all be hearing about this because we'll need your support, telling your story and participating with us on these days on Capitol Hill. VBF continues to advocate for all of our children and adults to get the proper diagnosis, we say accurate diagnosis, and the appropriate treatment. So I would like to
congratulate all the efforts of that VBF and you particularly, Linda, are doing on this, because that's a really great that's really great to be able to get so far, and I believe that you will get there. Only even we know that there's some bumps on the road now with all these priorities of the current government, that you will reach the goal that you are pursuing. And you have all our support on that.
Thank you very much, and thank you for being here with us. I'm going to do my best to end the meeting. I mess up sometimes with it, but thank you, Dr. Cazeau, and all of you parents who are still listening. These are archived on our YouTube channel, and you can watch them over and over again. So thank you all, and stay well and stay safe.
Have a good night, everyone.